Hi everybody, Tashi here from Pixie Mommy's Reborns. Welcome back to my channel, and to everyone new, hello and welcome. So yes, I'm back already. I'm back with the little man of the hour here. To those of you new, or to those of you that didn't see him arrive yesterday, his box opening. This is Milo. And Milo is the Janika sculpt by Claire Taylor Dolls. This particular baby is this particular Janika is a baby boy, and he is actually a one of a kind. He's an artist proof. So he was done in, I think, mid to later 2017, I believe. Whereas the Janika was sculpted, years ago. But Claire had did this additional baby, so that he's with all the new and features of all her newer dolls. He's in the one piece with that super soft silicone and all the bells and whistles. So here's the little main man. Look at that little face. He's definitely not focusing on the camera today, but he's gonna have his first bottle feeding here with me. So I thought that would be exciting, and that I would, you all might want to see that filmed. And, just the moments we want to capture on film, right? Right? Say hi, aunties and uncles. He is, oh my gosh, is he just the perfect newborn? Perfect newborn size, newborn sculpt. I just love that. So I have, he's going to get his first bottle feeding with Claire's signature bottle. I'm cheating a little bit. This one's Oscar's, but Milo has the exact same one, and Oscar's was already filled and prepared. So he's having his brother's bottle. And we have the lubricating KY jelly that I always use to protect their mouths from friction and paint rubbing and or stretching or tearing of the silicone. It's a trick many silicone doll collectors have been using throughout the years. And I use it for the passies too. Passies and bottles. Anything that's gonna go in his little mouth. So there he is. Say hello. Hello. I'm finally getting to come up here today and, get a look at him and kind of hold him. And anyways, so it's just, when you get a new baby like this, it's just, it becomes an exploration, right? So, okay, here we go. You can have his bottle. I put a little too much on there. I just fix that up. Okay, buddy. Here you go, baby Milo. There we go. In you go. And Milo does have a drink and wet. As I said, he's got all the bells and whistles. He's got the drink and wet. He's squishy tummy. He's in the very soft silicone. He has the spine, tongue, gums, uvula. Really just, he's got it all. Same as Oscar does, except Oscar's armatures are no longer working. They unfortunately weren't working when I received him, so I kind of never had them working in him, which is fine. with me. Oscar is extremely soft and very posable. So either or. And I actually like the looseness of the, without the armatures. It's kind of that age old, dilemma: armatures or no armatures, full armatures or elbow armatures. That collectors, talk about with silicones. And honestly, it really just, I think, depends on the doll. And I would say my overall preference is probably not to have them. But if the doll does have them, it's not going to stop me from, you know, having the doll, if that makes sense. And actually, I may come to enjoy these a little more with Milo, because he is so newborn. And they're very in particularly like his hand, the sculpt of his hands. Like, he can wrap his little fingers around mine, and it just, I don't know, like, I think I'm just gonna get some really amazing, yeah, here we go. I can put his arm like up to show you, like, kind of see if he wants to hold his bottle a little bit. I just think for photos and, videos and things, that it's gonna be enjoyable. I mean, look at his hands. He's just got these beautiful long fingers, and they just, oh gosh, do they feel so real. They look so real. They look so newborn. And so that's really fun. And you just playing with that? Are you hungry? Are we hungry? I know you're a good eater because you got the pudgy little cheeks. Yeah, you're not a tiny newborn. But you are newborn, nevertheless. Don't know how much Milo weighs, because that's not on Claire's COA. I noticed it's not on Oscar's either. And I happen to, even though I got only just a couple little pieces of Oscar's original, which is kind of the same at Milo. One thing I did get of Oscar's was his hospital bracelet, which said his weight on it. It said his length and weight, which I believe Oscar's is, I know he's 9.5 pounds, and I think he's 21 inches, but don't quote me on that. So I'm curious how long Milo is and how much he weighs. I wonder if maybe his hospital thing is floating around somewhere, or one of his other mommies just maybe knows. I don't have like a baby, I don't have a scale to weigh him. But anyway, so I still am recouping here from the oral surgery I had. I didn't even get to tell you all here on YouTube, like, the whole story and what happened. And I will, I mean, it's a horror story, but nevertheless, it's my story. And this is kind of like the third day, sort of. It was on Tuesday. Plus, like last night, I feel like the antibiotics really started kicking in, at least, or kicking butt. My system, I think this happens to a lot of people, like my it really wreaks havoc with my digestive system. So I was having some tummy issues, and just really just feeling, I'm very, very tired. And, yeah, so, still some swelling in my, face and mouth. Not as bad, and it's definitely gone down a lot, which is, and I can see it looks good, it's healing, it looks clean and good. And so Let's see if you want to burp. Let's see if you want to burp. We don't want a gassy baby. No, no we don't. No we don't. I really should get a little bib, like a really cute bib that I love for the boys, for bottle feedings, or for all of them. And a little, burp cloth, like a little bib and burp cloth, right? Oh, yes we are. Yeah, we are. Oh, get your burps in. Oh, put you up a little bit. I just don't want to put my face on because, I'm close up and my mouth doesn't look good, and I don't have my upper teeth partials in, and so it's even looking worse than it normally does. I go to the dentist on Tuesday, so and that's not, the oral surgeon's not doing follow-ups unless you are having a problem or need to get sutures out, which usually don't, because if you do get sutures, they're dissolving, but because of COVID, because they can only have one patient in there at a time, and it is so backed up. They were booked out till January for an emergency extraction, and then they actually bumped me to October 28th for an emergency extraction. That's how bad, I did not realize, and all the oral surgeons, that's going on. I guess because the dentists were closed for so long, and then that was a place that people feared, when they did open back up. It was like the last place people wanted to go was the dentist. And now, of course, everybody that let things go, which was my case, although I had let it go a bit prior to COVID, I kept putting it off, but I would have definitely, of course, had went in by now before. So, okay. Oh my goodness. So, yeah, that it's a problem. There's a shortage of oral surgeons, and now they are open, but there's criteria. Like the oral surgeon, when I went, they can only let one person in the waiting room at a time, and they're in their office, their facility, they can only have 2 patients in rooms, and they can't cross in the hallways or anywhere, and that's it. So whereas years ago, I hadn't been to that oral surgeon in like 7-8 years, but I mean, it's usually a packed waiting room, and they just and they have 4 or 5 rooms lined up, and they just get you in and out, and they know their stuff. Their staff is terrific. I've always loved them. The oral surgeon, he's just, he's seasoned, he's good, he's compassionate, and he just, I can't say enough about them. So, they see a lot of patients. Well, they can't do that now. I mean, literally all the chairs were covered in plastic. Even the clipboard and pen they hand you, the pen's covered in plastic, and I mean, everything was just a complete sterile environment, which is good, but again, we got all these emergencies going on. Now in my case, there was a severe infection that I didn't even know was there. I thought all the pain was just because there was the tooth was half there. It was just open, and the nerve was exposed. You could see the nerve, you could see the canals and the nerves. So I was like, well, that's what the pain is. And there wasn't any sort of swelling or anything until I couldn't handle it and went to the emergency room on Monday night. And they try as they might putting shots into it, and they went right up into the top, into the pulp, down into the nerves and stuff with the needle. Couldn't get me numb. And then that swelled my face out really bad. I guess that all that, Novocaine that they pumped in there, because the infection wouldn't allow it to, numb the tooth and get in there. It was just pushing everything out and around. So then everything, swelled up. So 5:30 in the morning, I was on the phone with my oral surgeon telling them, they gave me an emergency appointment for October 28th, and I couldn't even make it through the night, and I was crying, and I was like, I wanted to call first to call early if there's any cancellations, to get in. And they called me back as soon as they got in the office before 8 o'clock. And when I explained what was going on, and I just was crying, and she said, oh yeah, come on in. So I guess they are kind of triaging the way people sound, and stuff on the phone, and the fact that I couldn't even make it through the night. So it was evident that it was a serious emergency, and not just like, ouch, this tooth hurts and I, just need it out, type of thing. Like, there's a difference. Because I've had many, teeth that needed to come out, and I was in some pain, but I wasn't like on my knees begging God for mercy and fearing, having a stroke because my blood pressure was so high. I'm sure you all have been there as human beings at some point at one time or another in life. But holy crap, let me tell you something. I would have rather have been giving birth to all 4 of my kids at one time than what I was going through. And it just reminded me of course, it's a totally different place in the body, but it was the type, it was the intensity of pain that I had right before I went in for the emergency spinal surgery. That's the pain that I was dealing with, that inhuman pain that your body just can't handle, and your body is just shutting down and saying it's just can't handle anymore. So anyway, well, I told you I would tell you the story another time, and you got the short story. There's a long story of, oh my gosh, what I went through with the insurance company and the dentist, and then the referral, and I just, wow. So it's a bit longer. There's a little more to it, but you got the short version because, heck, this is my vlog, right, Milo? Right, Milo, man? Say hi, aunties. I didn't know what to do with him first. I was like, he's got all these beautiful clothes and all this sweet, loved baby stuff that Kelly sent for him, Auntie Kelly, and I just didn't know where to start. And then I'm like, wait a minute, always when babies come home, I'll put them in a onesie or a hospital shirt, to just appreciate and enjoy their sculpt and the newness of them. So I'm like, he belongs in a little hospital top. And I sure feel like I just brought a baby home from the hospital, and the fact of how my body is just tired and all that. So it's a good day to just chill and be home, right? Be home. Yes. Oh my goodness, yes, yeah. So yeah, so I want to share things that are going on or have gone in my life that I can share here. I don't share everything, but some things I can or want, will share. So, a lot of, I share what was going on with the spinal surgery and beforehand and afterwards and everything, and I share stuff like that. And I will share, because I'll be doing spinal surgery too, but and that'll get shared again. But anyway, that leads me to just putting it out there that doing the YouTube and sharing my collection on YouTube is just a hobby for me. It's a vlog of my dolly journey here, and I put it out in content to share with any other doll collectors or folks that want to watch, bottom line. And that's it. I have created a channel membership. So I have an exclusive membership on my channel. There's always a link in the description down below, or you can click the blue join button next to subscribe. It's $1.99 a month. That's all inclusive for the $1.99. You can cancel it anytime. You do need to be 18 years or older, but for literally, when you think about it, for literally less than the price of one cup of coffee a month, you're getting a membership. Inside my membership, that's where I do like my live chats, my live streams. So I do exclusive live streams, and there's exclusive content posts. If you click on, you can see what the perks are. And if you just want to check it out, basically grab a cup of coffee and come on and check it out. And, you can, what I'm trying to say is because I'm getting a lot of, folks that are asking like multifaceted, like in-depth questions that kind of require, it would be so much to type out. It kind of requires like a video response, or asking for video requests of questions they want answered, things that they want to know about either collecting or my collecting, or like just dolly things to do. And so the Pixie Squad would be a place to do that, because if you come into the live chats, well, if you catch the live, you can go back and forth and ask me questions that I can answer, plus everyone else that's members in there. And we have everything from newer collectors to, very, very seasoned collectors. We have some artists and everybody in between. So everybody will weigh in, and, so if you have questions about, buying dolls, prices of dolls, sculpts, clothing, sizes, you name it, it's game, except drama. No, and when I say drama, I mean like, you all know what I'm talking about. I don't mean like, fun stuff. I just mean, forget it. It's doll collecting. That's it. And it's fun. It's everybody's kind of networking in there. It's where if I let any dolls out of my collection go, and I'm gonna list them if they don't kind of have a mommy lined up, I post them there first. So there's a lot of benefits there. And if you don't happen to catch the live stream, but you can still leave like a comment, and then I will go back and forth with you in a thread, or answer you with a video, and make a video, and just what I do inside the membership. So if you're looking for that sort of interaction, networking, and exclusivity, come on in and check out the Pixie Squad. Because out here publicly, like, I have so little time on my hands that I just like I said, I create content to share my journey, and if people, want to be here, they watch. I read all my comments. I enjoy you all so much. Sometimes I'll, respond. Sometimes I'll just, heart it after I read it, so that I read it. Just that all depends on usually time, because I like to chat when I can, and I try to kind of alternate a little bit for folks that are regularly here on my channel. If I haven't answered one person in a little bit, I'll answer them, and then I'll try to flip-flop it, and try to get to know new subscribers to my channel a little bit, just to get a little base of know who they are, and stuff like that. I definitely try to do that because I enjoy doing that. It's part of the hobby, and I enjoy it. But past that, like, I'm not necessarily able to, if I did everyone out here is like video requests, I would just be like, I wouldn't be free to just do what when I do a video, it's usually spontaneous, and I feel like feeding this one, I feel like showing that one, and I just pop on the camera and share with you all. And whatever I start talking about is the topic that comes out of my mouth. Most of you that have been with my channel for a while, you know that. But yeah, that's what I kind of do out here. So that's kind of why I created the there's a lot of reasons why I created the Pixie Squad, but one of them is there was so many questions and such a demand for that more of like personal exclusivity and things like that. So that would be the place to do it, because that's where I'm spending my time, doing the interacting, is in there. So I want to put that out there, and invite you all again. Everyone, it's a really fun place to be. These days, people are looking for virtual places to socialize, because we're not socializing necessarily in the same ways or capacity that we were prior to the pandemic. So you can't go wrong for $1.99 a month, a cup of coffee. You can't, you basically could say, I'm buying Pixie Mommy a cup of coffee a month to hang out, like take me for a cup of coffee. You know what I mean? Like, so if you just put it in that perspective, because I'd like to get as many folks, together in there. That's what it's there for. I created it for it to grow, for us to grow together and network together. So come on in, check it out. And I promise you, if you don't enjoy it, you just click on your membership and click cancel, and it stops charging you. That it's simple. It's not like you got to jump through hoops and, oh my gosh, I got to go do, because some things you subscribe to and forget about it, then you got to jump through 10,000 hoops to get out of it, and then you forget, and it keeps, I know the deal. YouTube doesn't do that. It's all through YouTube. It's all automated through YouTube, and it's just simple. All right, folks, now this video got long, but I did want to explain that all to you. All right, and if you're not interested in joining the Pixie Squad, and you want to enjoy following my journey here, my collection, and seeing my dolls, hearing me chat, leaving me your lovely comments, that I love you all for your comments so much. It feels so good to read them all. You all are wonderful. Definitely hit that subscribe button. Go now and make sure that you are subscribed, and hit that notification bell so you never miss a video. And everybody check now, my Pixie Squad, my subscribers, go check, because that notification bell, when you push on it, there's 3 options to get all some or none notifications. And a lot of people don't realize that. They just hit it and it selects a setting for you. Because I know some folks will say, you know, oh, I didn't see you had a video up, or, you know, I didn't see the post, you know, for the live, you know, because YouTube's not notifying me. And sometimes, I mean, I know YouTube can be glitchy, but sometimes you got to check and make sure for that channel you have the bell on the settings that you want it on. Because I noticed that I wasn't getting notifications for certain channels that I wanted to, you know, be right on. And I went, and sure enough, when I put, you know, pressed down on it, it had like to get only some notifications and not all of them. So go check your bell, ding ling ling. If you enjoyed this video, please go ahead and give it a thumbs up. Of course, if you didn't enjoy it, give it a thumbs down, or give it something, right? And that's it, everybody. I hope you enjoyed Milo's first feeding and me yammering away as usual. Lots of long videos up here for you all, but they're here for those that want to enjoy. All right. Love you all. Till next time. God bless.